Well, data shows that Kentucky's rate of sexual violence is higher than the national average, and advocates want to change that.
So they went to the Capitol to urge lawmakers for better tools to prevent sexual violence and strengthen survivor services. LEX 18's political reporter Carolina Buchek has the story.
Advocates for sexual assault victims say this is what they're working on, building a safer Kentucky. And to do that, advocates say they need lawmakers to make some changes.
As a teenager, I was raped. And when that happened to me, the laws didn't protect me adequately.
Sharing her own story, Jenna Cassidy with the Kentucky Association of Sexual Assault Programs told advocates that they can help change Kentucky's laws.
I was a teenager when I was raped, and the legal challenges that we faced at the time created barriers to a successful prosecution.
Cassidy wanted to make sure others in Kentucky didn't face the same problem. So a few years ago, with the help of a Kentucky lawmaker, she pushed for changes to better protect teens who were raped. And this year, she and other advocates are pushing for more changes. One of the bills they want to see become law is House Bill 521. What this does is update Kentucky's stalking laws. Advocates say the current laws are outdated because they haven't kept up with this stuff. Phones, computers, and other technology that stalkers use to exploit victims. The Kentucky Association of Sexual Assault Programs is working with a woman who was stalked for more than a year.
Everywhere she went, posting pictures of her online, sending her unwanted gifts. She was an athlete. He sent her a pair of custom shoes. He knew her shoe size. Think about that.
Advocates say police and prosecutors couldn't really do anything about it because of the way that Kentucky's stalking laws are written.
He never made a threat, so prosecution for stalking wasn't an option.
Another bill being pushed for is House Bill 134. What this does is create a statewide coordinator for SANES, sexual assault nurse examiners. These nurses are highly specialized to work with victims of sexual violence.
We know that these nurses provide the best care. They advance prosecution. Their input, their involvement in the medical response of sexual assault is pivotal.
The problem Kentucky has now is that there's no infrastructure or communication for these nurses. So access to SANES is currently inconsistent across Kentucky.
So when a victim presents at the emergency department, even though a SANE might be nearby, there's a lack of communication, a lack of infrastructure, so that SANE might not be available to come and help that survivor.
CDC data shows that 45.8% of Kentucky women and 30.2% of Kentucky men have experienced sexual violence. So advocates say Kentucky needs stronger laws. In Frankfort, Carolina Buchek, LEX 18 News.